Welcome back. We are glad you have still chosen to continue this journey with us here on Good Morning Kenya. For those of you who are communicating with us on Twitter, we thoroughly appreciate you. Keep doing so. And remember to also let us know which part of Kenya you are watching us from using the hashtag Good Morning Kenya on Twitter. At KBC Channel 1 is the official station handle. My handle is at Jain Wambui. Now, just a bit of feedback that we have received from the previous conversation. I see Captain Korir saying in regards to the interview that my colleague just had with Honorable Martha Karua, saying that she is better off as the governor of Kirinyaga as opposed to the incumbent. We also see Senior Stephen saying that this is why we need more women representation in top seats. She speaks the talk, and it's not a question of, fearing the powers that be in the state. Thank you so much for being part of that. We urge you to continue sharing with us your thoughts as we move on to this next part of the conversation. And this is all about the International Nurses Day that we are celebrating today. This is a day that is celebrated every year just to take stock of how far we have come with our nurses in the country. And we have two representatives with us in studio this morning to help us understand the situation here in our country. What are the achievements we have made so far? The challenges that we have been facing as a country before COVID, during COVID, and right now what we need to adjust to as we move on to this new normal that we are slowly but surely adjusting to. Now, let me just let you know who we have with us in studio this morning. And to my extreme left, we have Francis Ogola, who is the principal registered nurse under the Ministry of Health. Good morning, Francis. Thank you so much for being with us today.
Good morning.
Karibu sana. And closest to my left, we have Alice Muthoni, who is the acting deputy director in charge of nursing under the Ministry of Health. Good morning, Alice.
Good morning to you.
Thank you for being with us today. Now, the theme for this year of the International Nurses Day is Nurses, a Voice to Lead, a Vision for Future Healthcare. And this is more so ringing loud and clear in light of what we have seen for the better part of last year when we were dealing with COVID-19. And even now, as we continue to deal with COVID, what more can we do to make the profession, safer and tolerable and accommodating for our brothers and sisters who are in this particular field? Let me just start with you, Alice. Maybe for the benefit of our viewers, we could also just try and go back and understand, the journey of our nurses here in the country, and more so looking at the figures. Do we have statistics of the number of nurses that we have in our country?
Yes. Thank you, Wambui. In nursing in Kenya and in globally, it has been developing quite for some times back. And today, as we are talking of the International Day of the Nurse,
yes,
we are remembering the founder of the modern nursing in the world, not in Kenya alone. So this is a day being celebrated globally by all the nurses in the world. And this is the day that was enacted in January 1974 by the International Congress of Nurses. And so from there we found that Florence Nightingale, who is the founder of nursing, went to a war battle where she started treating wounded soldiers with a lamp at night, and she led a team of 38 nurses. And actually she started formulating the modern technology of nursing, which now we have moved from where she left to where we are today, to now a more better nursing than what she had. A nursing with higher education, a nursing which has leaders who are nurses, and nurses who are decision makers, and are nurses who can listen and advocate for their patient.
Absolutely.
So in Kenya today, as we stand, we active nurses, we have around 49,574 nurses, active nurses, as per the records from the Nursing Council as up to December 2020.
Now, just looking at the uptake of nursing as a profession over the years, how has the trajectory been like from the population?
Initially, nursing used to become very popular, and people are really enrolling in high numbers, and especially in early 90s, the enrollment to MTCs was very high. We went further with and started enrolling degree programs for nursing in various universities in Kenya, and the uptake was also very, very high. But now when the government stopped the direct recruitment and people started getting frustrated, you find the recruitment has started declining, but we are still encouraging our young Kenyans. Nursing is a noble profession. It's a scientific profession that we need to adhere to, that will bring sanity to the humanity, to the people we serve in the nation, because we are the mouthpiece of those who cannot talk. We alleviate suffering, and we are the amputee of those who cannot walk. And therefore, since we are the pillar and the backbone of the health sector globally, because we constitute 70% of the health workforce globally, then we still need to encourage more nurses to take nursing, more young people to take nursing, so that we can be able to continue with this work, because it's noble to see somebody who could not walk, you have assisted that person to walk, and then he can be able to perform his duty. There's nothing that makes somebody happy like having assisted a patient who was not able to do something, and finally you see the fruit of that person. There's nothing important like seeing a mother who has come with obstructed labor. You have managed that mother in labor who was screaming in pain until she has a live bouncing baby, and then the baby cries and the mother jumps and starts auto shouting and crying with a lot of joy. These are moments that nurses need to enjoy, and the whole world and the whole population should also celebrate with the nurses, because we help people to achieve all this.
Absolutely. And let me just come to you, Francis. Just maybe you could tell us a bit about, what is it about nursing and the medical space that got you interested in it in the first place?
Thank you very much. Basically, nursing is a helping profession, and it is a caring profession. And actually, it gives somebody joy to assist and to help somebody recover or live near to normal as much as possible. Okay, there are cases where you cannot bring back somebody to the normal, but if you bring somebody nearest to normal, that person has been assisted. Extreme cases are there where somebody has to pass away, but then this person passes away comfortably, knowing that this person was assisted. Those are key areas in nursing that makes it a noble profession.
All right. And maybe from a gentleman's point of standing, for most of the people, when you talk about nurses, the first person that comes to mind is a female. And this is from the common Mwananchi. So maybe we would like to hear from your point of interaction, from your point of experience. What is a day like for you out there in the field as a nurse?
Thank you very much. That is an interesting bit of it. I know, even me, when I joined college and I told people I'm doing nursing, it's like, are you sure you are doing nursing? Then I said yes.
Or you are being a doctor.
then somebody asked me, you are sure you are seeing women naked? Then I tell them, yes, I see them naked, especially when they are delivering. So those are to the public.
Opinions that we have.
Those are things that as a man you have to contend with. So I would say that it is interesting, but not regrettable, because by the end of the day, one, it is work. Two, it is a profession. Three, there is no written law that says this must be a lady and this must be a man. Basically, all that we hear are public opinion. Just like when you hear a doctor, you automatically see a man. So even in the hospitals, when patients come, they will call female doctor sister, and then the doctors will get irritated and say, no, I'm not sister.
I'm actually a doctor, yeah.
So those are there as public perception and public opinion. Mm-hmm. It is something that people grew in it, and this was also brought about by the missionaries. Most of the nuns ventured into nursing so much. So, and that's how the name sister also came in. Mm-hmm. So, the public opinion has that, but professionally,
gender doesn't
matter.
That, yes.
Gender doesn't matter, and we are okay with that, and we contend with that.
Yes.
On a day-to-day work, it is challenging anyway, because you have to strain all the way from morning when you come in up to the time you get off work. Nursing basically is labor intensive. You have to do it. There's nothing like you're going to make a call and say this. If it is inserting a catheter, you have to bend there and insert that catheter. If you have to deliver that lady, you have to bend there and make sure the baby comes out. So it is labor intensive.
Yes.
So basically, once you finish your work, you are just as tired as somebody who was in an industrial. Basically, sometimes we call it industry, especially when you are in labor ward. Yeah? Because or when you are in theater, you just call it industry because you have just to do and do and do.
Yes.
Until the results come out. So you end up being tired, you end up being exhausted, and a lot of times there is burnout. However, as you get the results, then you get a relief. You get a relief back. Yeah. So when you see that lady telling you thank you and holding her baby, you are relieved. When you see that the person who had a fracture telling you thank you, they are going home,
yes,
then you are relieved. So it is both relieving and taxing. Yeah.
All right. Now, let me also come to you, Alice. Maybe your experience, when, at least in the field, interacting with the patients on a daily, clearly gender stereotyping is still something that exists, especially among the population, because of our narratives, what we have believed growing up. A nurse should be this, a doctor should be this. But what has been your experience been like in the industry?
Okay, thank you, Chair. As he has said, nursing is labor intensive. Mm-hmm. And because this is not where you say, I'll take a pen and just write. We are very different from medical officers, mm-hmm, because our medical officers will come and they will depend more wholly on what the nurse has done and some of the decisions the nurses have done. That is what will drive them to make a diagnosis. A medical officer will only stay with a patient for only 5 minutes to 10 minutes. But a nurse will stay with the patient 24/7. Mm-hmm. And so you find that during this time of interaction, you are dealing with people with different conditions. Sometimes you found a patient came smiling, not knowing the condition the person is suffering from.
Yes.
It is very frustrating when you find probably a patient who walked in and he probably had internal bleeding, which was not diagnosed early, and you find you are doing last offices to that patient. You are sending that person to the mortuary. It demoralizes you in line of duty. You feel demotivated, but you sit down and reflect and ask God, what do I need to do? Because there are other patients who are there. So you take the courage, now you move to the next patient. Other times you find that some relatives who come to see the patient, because the nurse interact with the patients and the relatives. Because at every moment you find that you visit a hospital, the first person you meet is the nurse. When the relatives come, they meet the nurse, who respond to all these queries surrounding them. With this burnout in this nurse, with all the complaints, they come. Any complaint in a hospital ends in the nurse's desk, not even in a medical officer's desk. And so you find that this kind of work sometimes create what he has called the burnout in the nurse. It also causes some frustrations. It also makes somebody feel, did I really make the right decision? But when you reflect back on yourself, you ask yourself, the hospital bed belongs to all of us. The hospital belongs to all of us, because today I'm Alice Muthoni, who is the acting deputy director. If I fall sick, that title just go off and I become a what? A patient. Truly, the hospital bed does not know the president, does not know anybody, because even right now, our His Excellency, the President of the Republic of Kenya, if he is admitted in any hospital, he just become a patient. We will not refer him the president. The first name will be the President of the Republic of Kenya. So it's actually challenging because you meet people of different status. Sometimes some, like now we are talking in a health setup where you find that probably you don't have even the right equipment to manage this person. So you find, what am I doing for this patient? I'm somehow handicapped. Other times, you find that the relatives, they come bouncing back to you as if you are the failure. Because I remember like an encounter, a mother came, a mother once went for a family planning service, and the husband has told her, I don't want another baby in this house of mine. But there was this man, unfortunately, we don't know what happened, whether she got the injection or not. She failed. And now the man comes now calling the wife, who is 7 months pregnant, draw the wife to the nurse, because you are the cause of all this problem. But you are not the mechanism of the body. So the community need also to appreciate the role the nurses do. And if something happens, because in everything that we do, there are failures and successes.
All right. Now, allow me to just come in at that point. And I like the fact that you've mentioned the role of the nurse, because even as patients, we all come with our own opinions, what we think should be done, what I should expect in terms of service. I come with my own diagnosis, and most of the times, tunakuanga vichwa ngumu sana. We want to treat ourselves. And you find even by the time we're coming to the hospital, we have tried self-medicating and probably made things worse. Now, for the benefit of our viewer, once again, what are those roles that are a responsibility of the nurse in the hospital space, right from the time you interact with the patient?
Okay, once you start interacting with the patient, the first thing is you greet the patient to allay anxiety. Because you must become a friend to the patient for the patient to be able to communicate what he or she has made that person come to the hospital. It's after you have established a relationship with the patient, which is very vital in the life and treatment, the patient will pour out what has brought him. This is where when you take the history and you take the right history, you'll be able to decipher the myths the patient has. You'll also be able to collect whatever medication, if there is wrong medication he has used, you'll be able to identify. You'll also be able to give the right health information to help this patient in the managing the condition the person has. And then you also be able to direct, if it's any treatment, the mode the patient is supposed to use. So you'll be able actually to be collectively and holistically to approach this patient in order to give the right information, in order to boost the quality of care for this patient the right way with the right approach.
Absolutely. Now, let me just come to you, Francis. You know, when it comes to dealing with troublesome patients, and maybe I'd like even to just hear from you, is this something that you are taught when you are in school about dealing with patients, especially those who just come with their own opinions, preconceived opinions? Some may be misguided, others could be guided, but they're just troublesome and they want things done the way they think should be done, as opposed to how you, as the medical practitioner in this case, knows things should be done. How do you handle such situations?
Thank you very much. Such situations are very common, especially currently when we have the technology. People do a lot of searching even before they come to the hospital. They have called almost all the people they know they have headache, so they have been given all the opinion. If you have headache, it is this and the other one and the other one. They have also gone to the internet. They have read 1, 2, 3 about headache. So when they are coming, their minds are already clogged. So they would also expect you to follow the same direction.
Yes.
But note that by the time what they are expecting you to follow, they are already in the bush, because they have so much in their mind that they're in the bush, and you need to get them out of that bush to the road.
Yes.
That's where the challenge is. Actually, we are taught and trained on how to handle them, and especially the guys with the mental conditions.
Yes.
So the first thing, as a medical or as a nurse practitioner, is to be focused and patient. Yeah. Sometimes it just takes you time to just keep quiet and let them pour out. Yeah. So once they pour out, then you bring them down and tell them, okay, you have said all this, but now this is the direction. From what you have and what I've seen and what I've assessed, this is the direction I would want us to follow. Some of the challenges come with position. Somebody is maybe an MP, so they come with their MP to the hospital. Somebody is maybe a lawyer, so they come with their lawyer to the hospital. Somebody is maybe a director, so they come with their directorship to the hospital. So all these again play into the complexity of management of these clients.
Okay.
So at one point, you just have to hold. First of all, allow them. Pour out. So once they pour and they remain empty, then from that you pick and you give them,
and return them back to the path.
And you give them direction.
All right.
Yes.
Now that brings me to now this bigger bracket that is called the challenges that nurses get to experience. And I just want to start with you, Francis, at that point. And let's just start with the workload that is involved. They say that nurses are the backbone in the health system, the healthcare system. Paint a picture for us of, workload. When you talk about it as a challenge, what do we really mean?
Okay. When we talk about workload, it is in phases. Phase 1 is the number you are dealing with.
The number of patients?
The number of patients you are dealing with.
Okay.
So sometimes we have the official ratios, but in our situation, we go above those ratios. So you find sometimes one nurse has 60, 70 patients. And
this is in a day?
Yeah?
Yes.
And you have to serve all of them. Now, ideally, the procedure requires that you must pair. Yeah, we work like police anyway. You must pair the two of you per patient. But it is not workable, it is not practicable. Sometimes you have to work alone. So this brings certain challenges of legal issues. So if a lady accuses me to have touched her wrongly, then I don't have somebody to say, no, I was present and he did not touch her.
Inappropriately, yeah.
Inappropriately. So it is my word against
the patient's.
Patient's word. So that becomes a challenge, especially when you talk of numbers versus the practice. Then we have the working hours. Yeah. Ideally, you are supposed to work for maximum 7 hours. Yeah, from 7 to 1 or 8 to 2. That gives you a maximum concentration. But sometimes it is not possible because you find the shortage makes you now exceed that to
cover the next shift.
To cover the next shift.
Yeah.
But let's say if you started at 7, sometimes you go up to another 7 as you wait for the night nurse to come. Night nurse also will do up to 7. So phase 2 is now in terms of working hours. So you find that as a normal human being, for you to do that 12 hours continuously, you are also strained in the brain and physically.
Now, still looking at that aspect of, the workload that is involved, this was pre-COVID, and now looking at the COVID time, how did the workload challenge become even a bigger challenge? Because we were seeing complaints about shortage, especially when it comes to the staffing of nurses.
During COVID, it even became more complex because there was that some of the nurses had to go to the isolation. Okay, the facility is already strained.
Yes.
But still they had to release a number to the isolation. So if there were 10, they have remained 5. Yeah? So the 5 are training in the hospital, the other 5 are training in the isolation. And the numbers in isolation was, well, initially they were so high. Yeah, they were so high because at that time anybody who was tested was rushed to isolation.
Yes.
The issue of home-based care had not been started. So the isolation centers were full. So it was also straining the nurses who are in the isolation center in terms of time and in terms of population. So that still gave a big shortage.
Okay. Now, let me come to you, Alice. Just looking at that aspect of shortage, what is it that is contributing to this shortage that we are seeing? Yet we have nurses that are going through the training process in itself and getting into the system. Where really is the disassociation from those that are in school and those that are in the industry practicing?
Okay, thank you, Chair. If we look at first of all, let us try to understand the economy of our country. The government is talking of a heavy wage bill. So you find that the government is not recruiting as it used to recruit for health workers and all civil servants. So with this trend, you find that the recruitment rate is lower despite the population is increasing. And so this will find that. And in recruitment, we also focus on issues like we have to consider we are replacing people who have retired. We have to replace those who have died. And so all cause of things that make staffs leave duty. So you find that if we cannot be able to replace that in a situation that had already shortage, then we are not able to meet the gaps of shortage in the economy. So we need to look at the economy of our country first as the pillar of all these issues, because we need to boost our economy so that we are able to hire more nurses or other medical or health workers so that we fill the gaps. So you find that and also it has also become very expensive that education, you find that most people are paying for their education in diplomas, and before the government used to sponsor everything. So you find that also the uptake that is there is also a challenge, and the salaries also that the government offer, most people may feel they are not comfortable with the salary, and that's why you find that most nurses opt to go to abroad where they are paid better. And so you find the shortage is a big challenge moving around that. And we also need to look at the issue like now you have talked about COVID. We need to look at COVID as a pandemic, because pandemic usually consume heavy on the human resource. Because right now the COVID, the biggest cost challenge that came with the COVID, that we had to open extra intensive care units in the country. And this intensive care unit, remember the ratio of nurse to patient intensive care unit is 2 nurses to 1 patient. Now, if you fill the intensive care unit, it means you need more extra nurses to work in these areas. So this now brings another shortage around the whole globe. And actually, it remains a challenge, because also in our training capacity, we cannot say that we have trained enough to serve the population of Kenya. So we need still to do more. And didn't know how we are going to solve them and support them so that we can even achieve the universal health care.
Now, looking at the aspect of the education and the training bit, we live in a time where the employers in the market space are saying that, most of the graduates that are coming out of institutions, they are not in touch with the industry per se. Is it the same situation in the nursing space? Those are coming from nursing school and getting to join the profession, the industry. Is there a disconnect where such that you have to start from ground zero when it comes to teaching them on the job?
Okay, thank you, Chair. I would say yes and I would say no, but we also need to appreciate a few things that are happening in our developing country, because in the training of the nursing, you find that you are trained with the patient, but also the parents and the public has also played a key role, because sometimes back it's only in the Ministry of Health where you did a course and you could not miss a job. And so you see, sometimes this course, as we have stayed from the word go, it usually has some frustration when you see people dying. So not all of us are able to withstand a dead body. Not all of us are able to withstand blood. But you, as a parent, you have told your daughter, your son, this is the course you are taking. This person will do the course because of the parent. When it comes to service delivery, this person will be very, very undermanned. And so you find that these are the people who just finish the course, they get out of the place. So these are some of the things that we are encountering, because the student or the people joining the college should also be prepared to face the challenges, to adapt to the challenges, to grow with them, and be able to adapt even when institutions go to the worst, because we have reached a time now that we have to accept some things are reality. Even a long time ago, we never knew what it means to lose a relative. And so, because death is not inevitable, we now have to live with it. That means even when we work in a hospital setup, death is part of the activity that you have to encounter. And these are some of the challenges that we face.
Okay.
Yes.
Now, let me come to you, Francis, and just to pick up from what Alice had mentioned, the question of pay, and consequently leading to a lot of brain drain here in the country, and not just Kenya, but so many other countries. How can we help the situation and avoid this state that we are in, where we are seeing some of our nurses not really comfortable with the pay that is being offered here and opt to go abroad for, better opportunities, better pay and all? Brain drain is a big problem when it comes to us as a country. How can we help that situation?
Thank you, Chair. The issue of pay is, I can say, it is either a perception or a reality. True, in all professions, people are rarely comfortable with what they are getting.
Yes.
So just like one of the musicians from my place says, if you are given a bicycle today, tomorrow you want a motorbike. You are given a motorbike, you say, no, I want a car. You are given a car, now I want an aeroplane. No, you are given an aeroplane, now you want something to take you to where God is staying. So, human beings are I can say so. But that does the pay is as high. All we are paid as government officers according to job group. The only thing that differs is allowances here and there. There are some allowances that are specific to certain cadres and some are not specific. So that makes slightly difference in terms of pay.
Okay.
But for quite some time, nurses have not been fairly remunerated.
Yeah.
And I think that is something that SRC, Salaries and Remuneration Commission, has taken up and is working on it. So there has been a lot of meetings between Ministry of Health and SRC. So we are also waiting to see if that would give some results and attract more nurses, because the government pay also dictates what the private sector pays, especially within the Kenyan space. So if the government pays 50 shillings, then private sector would say 70, so that they attract. But by the end of the day, the countries abroad will now pay higher, and that would be at an expatriate scale. The only thing is that when you are there, if you are being paid in dollars, you are spending the dollar. What most of us really don't understand is that when you are told, if you are in the US, I'm going to pay you 30,000 US dollars, then you multiply it by 102 and you say, oh, this is big money. Forgetting
30 million.
Now forgetting that when you are paying rent there, you are paying in that dollar, not in Kenya shilling. Yeah? When you are boarding a vehicle or going to the supermarket, you are spending that dollar direct, not the Kenya shilling. So once you are there, then you realize there's not much difference, but now you cannot come back. You have to just train here and there to keep up. Because again now, once you go to US with that name, and then you want to come back, is like a demotion.
Yeah.
So the issue of pay is a bit...
it's neither here nor there.
It's neither here nor there.
Yeah.
However, we are advocating, like through SRC, so that nurses are also well remunerated, to attract them and retain them within the country.
All right. Now, let's come to another aspect, and this is something that, became very clear, especially with the advent of COVID-19, and this is mental health care for the nurses. There were reports that so many nurses are experiencing mental breakdowns from the long working hours, burnout, dealing with death on such a higher rate that they were not prepared for in that time space. Looking at the aspect of mental health as a challenge, how is it being addressed? And, is it something that was being addressed before the pandemic, or it is after the pandemic that we are really shifting focus to that conversation? Alice.
Thank you, Chair. Every situation that we encounter has its advantages or disadvantages in life. And it becomes a milestone of each and every moment of our life. The COVID-19 pandemic clearly exposed the true state of the health system of Kenya. How prepared we are, what we have, and what we don't have. And this has also become clear even to the public, because sometimes when we talk, somebody says you're exaggerating. But now the public can clearly say, yes, there is a problem, or there is a good way, and there is a step that is being done. The issue of burnout had not been taken. Okay, in the institutions, people could meet and share out to release the burnout as a group. But the issue of forming a group counseling section was not very much automated. But with the COVID-19, because of the psychological torture that occurred because of the pandemic, which is still in existence today, because actually what we are experiencing today with the health workers is not what we experienced with HIV. Because HIV brought the psychosocial support for the public, but not the health workers. But this time, we have now the psychosocial support for the health workers, the frontline people, so that we can help them to cope up, because it was even funded through Equity. They launched the psychosocial support program with the Ministry of Health, which was funded by Equity. It was launched in the National Nurses Association office, and so a team was fronted so that it can lead the program of supporting the nurses and other health workers, the whole country, so that we can be able to get a few of what these people are going through, and we can be able to understand and help them to overcome the challenges, because actually it's very detrimental, especially when it comes to issue of psychological torture, because if we all of us become psychiatric patient, who is going to manage the other?
Very good question right there. Mental health goes full circle. Just because they are in the medical space does not mean that we should also neglect the mental well-being of our nurses. We want to take a very quick breath, but we'll be back to continue with this conversation. Remember, we are focusing on the International Nurses Day that we are celebrating today, and we'll be back to pick up this conversation from that particular point. So do stay with us. Be back in a bit.
Tonight on KBC Channel 1.
March, march, resist injustice. I'm moving much faster. When I make nothing stop me. Everybody needs someone to love. Everybody needs someone to care. They can stop my love now. None of them can stop my love now. A woman like you, oh, I don't deserve it.
Next on.
Subhanallah. Nataka unipigie zote pasi.
Hii swala naichoma.
Wewe nice, kumlete wangu upige pasi ama uikague.
Mimi nataka uwe shahidi yangu bwana. Sije kesho akaja hapa akija akasema mimi ninamchomea swala yake sikuichoma. Ameichoma. Wewe shahidi bwana.
Yaani suruali fuliwe, uletewe, itajichoma vipi? Muulize Aisha. Nimuulize nini yeye dobi?
Alileta ikiwa hivyo.
Huo nimechomeka.
Nilileta suruali ikiwa nzima. Haikuwa imechomeka popote.
Next on.
Habibi salamullah alayka.
Tuzungumzie funga ya 6 Shawwal na manufaa ambayo mtu anaweza kuyapata anapofunga funga hii.
Funge siku 6 katika mwezi wa Shawwali na tufanye ibada mbalimbali ile ataqarrubu ila Allah, kujikurubisha kwa Allah azza wa jalla katika huu mwezi wa Shawwal. Wabillahi tawfiqi.
li shajanun bi atfalin sigarin akadu idha dhakartuhum adhubu.
Welcome back. We are glad you are still with us. We want to continue with this conversation around the International Nurses Day, where the theme is the nurses, a voice to lead, a vision for future healthcare. And this is more so very loud and clear, especially during this COVID time that we are in. Just looking at the better part of the last year and a half, COVID has forced us as a population to shift our perceptions and how we, carry medical care in our country. And given that nurses are considered to be a backbone in the healthcare system, what better way to look at ways we can improve the healthcare system than through them as part of the value chain. Now, with us in studio this morning, we have Alice Muthoni, who is the Acting Deputy Director in charge of nursing under the Ministry of Health. And we also have Francis Ogola, who is a Principal Registered Nurse under the Ministry of Health. Thank you for still being with us. Now, let me come to you, Francis, just picking up from where we left, conversations around mental health. I'd also like to hear from you, from a nurse's point of standing. Why is mental health care for the nurses, why should it be considered as a priority, especially as we move forward as a country?
Thank you very much. One of the biggest question that even before COVID was being floated or was being asked is, who cares for the carer? Nurses are the carers, and who cares for them? So that's a question that has been there. But now, with the COVID, it was triggered on a thing, and some action now, some of the actionable points were now being realized. Because, as I said before, nursing is labor intensive. Stress and burnout are very common to the nurses. So, before COVID, in mental health, there is something we call implosion. Implosion means you are given a bang at once. If you bang something at once, it tends to burst.
Yes.
So this COVID came in with that bang. So one, it is a new disease. 2, it is a scaring disease. 3, the population is there, and it is a big population. So we have 3 bangs here, being new, being scaring, and a big population. So that gave a lot of stress to the nursing fraternity.
Yes.
So, and that is why the mechanisms for now counseling and taking care of the nurses came in. The stressors were in 2 prongs. One is on the family. Then 2 was on the work situation. Family, I mean, like when the COVID came in, you are released to a COVID center, then you are not expected to go back to your family because you are already in contact with the COVID clients. So you are somehow presumed to be infected even before you are tested, just by the fact that you are in contact. So you are not supposed to go back to your family. Even if you manage to go back, then you don't mix
for a certain period of time.
For a certain period. If you had 1 bedroom, then you have to get a kitchen somewhere to stay there.
Imagine that.
Until this period is over, so that you are declared safe. But it was not very easy to be declared safe, because again the following day you have to go back and work.
The same working space.
In the same working space. So the period keeps on extending. So the family keeps on wondering and also sympathizing, and they also stressed that our mother or our father may also go, because this disease is a killer. So all this compounded the situation. So you are also looking at your family, that is okay, as much as I'm working, how am I going to live in case? How am I going to leave my children? How am I going to leave my husband in case? So these in cases also kept on disturbing the nurses' minds. So then now the stressors, the work situation. Some of the clients were also quite arrogant. Huh? You know, as I told you, these people who fly, they come with very high egos. So simply because he came from US or she came from US, they make the matter worse, because now they think you should be serving them at another level.
Yeah.
That isolation was also stressing, because they are isolated. There is what they are expecting in the isolation, which the government may have not put in place, because this thing came in as a bang. So it's like they keep on making noise and they keep on blaming and all this and all that. So the clients in the isolation were also stressors, because they keep on, why am I here? Oh, this has not been done. Why couldn't you take me to hotel, such a hotel?
Do you
why
know who
are you keeping me in KMTC? Do you know who I am? I'm supposed to have been in Norfolk, and all those things. But you see, all these now narrow down to the carer.
Yes.
So all this brought in the mental and the stressors to the nurses.
All right.
So
now, you know, that's another reality that, you know, we just sweep under the carpet, because people come with their statuses to the doctors and the nurses' rooms, and we expect them to be treated as so. But I like the fact that you mentioned that whenever you are in the hospital space, you leave your titles out there. You become a patient. Now, as we draw nearer to a close of this conversation, given that health is a devolved unit, both the county and the national governments have a role to play when it comes to protecting and ensuring that the nurses are well cared for, even as they go about, you know, delivering their duties and responsibilities. From where you stand, you know, what more can be done in terms of investing when it comes to protecting the nurses and investing in the healthcare system, so that they are working with systems that work? You know, embracing things like technology to harmonize even records of patients from different parts of the counties. You don't have to struggle with a phone call to just get information about this patient who was from a different county. Things like those when it comes to investing. How can the county and national governments come in?
Okay, thank you, Chair. I think we need to look at what is happening in the world today. And as we said from the word go, the key thing that need to improve the health sector and the nurses in general, we need a policy that will enhance leadership of nurses. We need nurses to be recognized in leadership and decision making, because they serve as the backbone of the country. And in this, I mean that if it's in the management in the hospital, let the nurses be the lead people in making the decision, because they are the people who understand the patient from morning to the evening. They also understand all the other departments. Remember, in the matrix of our healthcare system, where we talk about quality healthcare, which is efficiency, effective and timely, the nurse must be involved. There is no single department in a hospital, either physiotherapy, occupational therapy, laboratory, will ever work without a nurse.
True.
So therefore, the nurse need to be there in this decision making. The other thing we need to improve most high is the improved high education for nurses. We need to recognize that we have moved from the certificate level, and we need to embrace that our nurses in the country have done to PhD level. And these nurses need to be included and they need to be considered and employed by the government, so that the skills they have, they can be impacted in the health system for the benefit of the Republic of Kenya. We also need to embrace the new technologies that are coming from the world, because if you check on when WHO was talking about 2020 being the year of the nurse, it's because they had seen the role the nurses play globally. And actually they have urged all countries, can we put the nurses in the leadership position so that they can help in making this decision? And they have also played a role. They're saying we need nurses, the entry point of nursing to be the degree level, because we need people who have education, people who can listen, people who can make informed choice without interference of other person, and people will stand for the position they require and do the right thing, the right time, so that everything they plan, they can be able to put the system and the right systems in place. So either from the national government down to the county, we need this matrix to be intertwined by all levels, by high-skilled professional nurses with leadership capabilities, so that we can be able to move as a system.
Right.
And also supply of the necessary commodities to ensure service delivery is accomplished the right way.
And I like that you mentioned the supply of the necessary tools that especially nurses need, because protective equipment was such a conversation and still is in light of COVID-19. But let me come to you, Francis. As we mark this day, the International Nurses Day, what would be your message to the public and your fellow nurses in terms of how far we have come and how far we have to go, and the role that we all have to play in this medical space?
Thank you very much. Let me start with the public. And my message to the public is that nurses are ready to serve them. They only need to cooperate and work together with the nurses for a better service. To the nurses are servants. They are called to serve. And nursing is a calling. So let them uphold that principle and give quality and better service to the public.
All right. Your message as well, Alice, as we close this conversation, again to the greater public, the nurses, and even the government for that matter.
Okay, thank you, Chair. The message, first of all, to the government is to embrace nursing leadership in all the positions in the government, especially in the from the Minister of Health down to the county level. And to the public, we are here to serve the public. We are here to journey with them, and we are not to leave them just like that, because we are also part of the population of Kenya, and we are not here to leave our economy being drained by disease burden. So we are standing with the government and the Republic of Kenya. And to my fellow nurses, I salute all of them, because they are heroes. They are commanders, and they have made it, and they have shown truly they can lead, and they can achieve, and they can deliver. Because if it was not for their giving the service they have given, we wouldn't have won the battle of COVID-19 to where we are today. We would be talking of something different. Actually, I salute all of them because they are heroes.
Absolutely. Well, from wherever you are, if you are a nurse, we do salute you. We see what you have been doing for us as a population. In as much as we might not be an easy lot to deal with, we still cannot do without you as part of our population. And that brings us to a close of this conversation. Remember, we have been looking at this day that we are marking. It is the 12th of May, a day that has been set aside internationally to celebrate our nurses. This has been so since 1974, when it was first officially instituted to just embrace and acknowledge the work that our nurses are doing. The theme for this year is a voice to lead, a vision for future healthcare, and of course the nurses, being the backbone of the healthcare system, have a voice and a huge role to play when it comes to the future of our healthcare system. With us in studio this morning, we have been speaking with Alice Muthoni, who is the Acting Deputy Director in charge of nursing under the Ministry of Health. Thank you very much, Alice. And we have also been speaking with Francis Ogola, who is a Principal Registered Nurse under the Ministry of Health. Thank you very much, Francis.
Thank you very much.
We wish you the very best and a happy International Nurses Day. As you mark this day, we celebrate you guys.
Thank you.
All right. With that, we want to put a cap on Good Morning Kenya. And again, we appreciate you for being part of this discussion. Vincent Ouma hapa anasema Propaganda ya BBI will be drilled into our heads, promising heaven and earth. Those opposed will be demonized and described as disgruntled elements. This is feedback from the previous conversation that my colleague had with Martha Karua. Jacqueline Hill saying we need to do away with this perception that we have about nurses, that they are only supposed to be women. Again, stereotyping that is in the society. Let me see. Ben Kamote na kuona hapo retweeting our feeds. Selector Arafat, we appreciate all you guys for being with us from the beginning up until now. Evans Serede, I also see you. Thank you so much for being part of Good Morning Kenya. On behalf of the crew here, we want to wish you a lovely day ahead. Do you enjoy the rest of your viewing? My name is Jain Wambui. See you tomorrow.